Melanoma, everything you need to know about this skin cancer. Melanoma is a type of skin cancer that originates in the pigment-producing cells known as melanocyte. Despite being less common than other types of skin cancer, melanoma is considered more dangerous due to its ability to spread to other parts of the body. This comprehensive health guide aims to provide an in-depth understanding of melanoma, covering its causes, risk factors, prevention strategies, early detection, and treatment options. Understanding melanoma. Definition and origin. Melanoma is a malignant tumor that arises from the uncontrolled growth of melanocyte. Melanocyte are cells responsible for producing melanin, the pigment that gives color to the skin, hair, and eyes. While these cells are primarily located in the skin, melanoma can also manifest in the eyes, ocular melanoma, and, although rarely, in internal organs. Types of melanoma. Superficial spreading melanoma. Characteristics. This is the most common type, often characterized by irregular borders and variations in color. It tends to grow slowly on the skin surface before invading deeper layers. Nodular melanoma. Characteristics. Nodular melanoma is known for its rapid vertical growth, presenting as a raised bump with uniform color. It may not exhibit the typical features associated with other types. Lentigo Maligna Melanoma. Characteristics. Typically found in older individuals, Lentigo Maligna Melanoma often develops from a pre-existing pigmented lesion on sun-exposed areas. It tends to grow slowly but can become invasive. Acrolentiginous melanoma. Characteristics. Found on the palms, soles, or under the nails, acrolentiginous melanoma is more common in people with darker skin tones. It often appears as a flat or raised discolored area. Causes and risk factors. Ultraviolet, UV, radiation, prolonged exposure to UV radiation, whether from sunlight or artificial sources like tanning beds, is a significant risk factor for melanoma. Understanding the importance of sun protection measures, including sunscreen use, and seeking shade during peak hours, is crucial in preventing the development of melanoma. Genetic factors. Individuals with a family history of melanoma face an increased risk. Specific genetic mutations, such as those in the CDKN2A and CDK4 genes, can predispose individuals to melanoma development. Genetic counseling may be recommended for those with a family history of the disease. Fair skin and freckles. People with fair skin, light hair, and a tendency to freckle are more susceptible to the harmful effects of UV radiation. The lack of melanin, which provides some natural protection against UV damage, makes individuals with fair skin more prone to sunburns and increases their vulnerability to melanoma. Sun protection practices are particularly crucial for this demographic. Prevention strategies for melanoma. Sun protection. Use sunscreen with a high SPF. Apply sunscreen with a sun protection factor, SPF, of 30 or higher to exposed skin, including face, neck, and arms. Reapply every 2 hours and more frequently if swimming or sweating. Wear protective clothing. Choose clothing that covers the skin, such as long sleeves, pants, and wide-brimmed hats. This provides an additional barrier against harmful UV rays. Seek shade during peak sun hours. Minimize sun exposure, especially between 10 a.m. and 4 p.m. when the sun's rays are strongest. Find shade under trees, umbrellas, or other structures. Regular skin checks. Perform self-examinations. Regularly inspect your skin, including moles and freckles, for any changes in color, size, shape, or texture. Use the ABT rule, asymmetry, border irregularity, color changes, diameter, evolution, to identify potential warning signs. Seek professional dermatological assessments regularly. Schedule routine skin checks with a dermatologist or healthcare professional. They are trained to identify subtle changes and can conduct a thorough examination of areas that may be difficult to assess independently. Avoid tanning beds. Artificial tanning risks. Tanning beds emit harmful UV radiation, which significantly increases the risk of developing melanoma and other skin cancers. Avoid the use of tanning beds to protect your skin. Safer alternatives. If desiring a tan, consider using self-tanning products, lotions, sprays, or wipes, as a safer alternative. These products provide a tan without exposing the skin to harmful UV rays. Early detection. ABT rule. Asymmetry. One half of the mole does not match the other half. Border irregularity. The edges are irregular, notched, or blurred. Color changes. The color is not uniform and may include shades of brown or black. Diameter. The size of the mole is greater than 6 mm. Evolution. Any change in size, shape, color, or elevation should be monitored. Regular dermatological checkups. Regular dermatological checkups are a critical component of melanoma prevention and early detection. These professional skin examinations, conducted by dermatologists or trained healthcare professionals, play a crucial role in identifying suspicious moles or skin changes at an early stage. Here's why regular dermatological checkups are important. Expertise and training. Dermatologists are specialized medical professionals with extensive training in skin health. Their expertise enables them to recognize subtle changes in moles or skin conditions that might be indicative of melanoma. Early detection of abnormalities. Professional skin examinations allow for the early identification of abnormalities, such as changes in the color, size, shape, or border of moles. Detecting these changes in their initial stages can significantly improve the chances of successful treatment. Comprehensive skin assessment. Dermatological checkups involve a thorough examination of the entire skin surface, including areas that may be difficult for individuals to monitor themselves. This comprehensive assessment ensures that no potential signs of melanoma are overlooked. Use of dermoscopy. Dermatologists often use dermoscopy, a non-invasive technique that allows for a magnified view of skin structures. This tool aids in the identification of subtle features that may not be visible to the naked eye, enhancing the accuracy of melanoma diagnosis. Risk assessment. Dermatologists can assess an individual's overall risk for developing melanoma based on factors such as family history, skin type, and past sun exposure. This risk assessment helps tailor a personalized plan for monitoring and prevention. Education and guidance. During these checkups, dermatologists can educate individuals about skin self-examinations, providing guidance on what to look for and how to monitor their skin between professional visits. This empowers individuals to actively participate in their skin health. Monitoring changes over time. Regular dermatological checkups establish a baseline for an individual's skin condition. Subsequent visits allow dermatologists to monitor changes over time, enabling the early detection of any evolving skin abnormalities. Biopsy and further testing. If a suspicious lesion is identified during a checkup, a dermatologist may recommend a biopsy for further evaluation. This diagnostic procedure involves the removal of a small sample of tissue for examination under a microscope to determine if it is cancerous. Treatment options for melanoma. Surgical excision. Overview. The primary approach for treating melanoma involves surgical excision, where the tumor along with a margin of surrounding healthy tissue is removed. Effectiveness. Surgical excision is particularly effective for early-stage melanomas, eliminating cancerous cells and preventing their further spread. Lymph node biopsy. Purpose. In cases where melanoma has potentially spread, a lymph node biopsy may be performed to assess the extent of cancer involvement in nearby lymph nodes. Diagnostic value. This procedure helps determine if cancer cells have migrated to the lymphatic system, guiding further treatment decisions. Immunotherapy. Mechanism. Immunotherapy involves the use of medications to stimulate the body's immune system. This boosts the immune response, enabling it to recognize and target cancer cells. Targets. Immunotherapy is effective in treating advanced melanoma by enhancing the body's ability to destroy cancer cells. Common types include checkpoint inhibitors and cytokine therapy. Targeted therapy. Focus. Targeted therapy focuses on specific mutations or proteins within melanoma cells, aiming to inhibit their growth and division. Precision. This approach is more precise, addressing the unique genetic characteristics of the tumor. Common targets include BRAF and MEK mutations, and drugs like BRAF inhibitors are used in targeted therapy. These treatment options are often employed in combination or sequentially, depending on the stage and characteristics of the melanoma. The choice of treatment is personalized based on factors such as the depth of the tumor, presence of metastasis, and genetic features of the cancer cells. Prognosis and follow-up. Staging and prognostic factors. Staging. Melanoma is staged based on factors such as tumor thickness, ulceration, lymph node involvement, and the presence of metastasis. Stages range from 0, in situ, to 4, advanced with distant metastasis. Prognostic factors. Tumor thickness. Thicker tumors are associated with a higher risk of recurrence and metastasis. Ulceration. The presence of ulceration on the tumor surface indicates a more aggressive form of melanoma. Mitotic rate. The rate of cell division in the tumor can impact prognosis. Follow-up care. Regular monitoring. After initial treatment, patients undergo regular follow-up appointments to monitor for any signs of recurrence or new melanomas. The frequency of visits is often higher in the first few years after diagnosis. Imaging studies. Periodic imaging studies, such as CT scans or PET scans, may be recommended to detect any signs of metastasis. These studies help in assessing the overall effectiveness of treatment. Blood tests. Blood tests, including liver function tests and tests for specific tumor markers, can provide additional information about the health of internal organs and the potential presence of metastasis. Emotional and psychological support. Support groups. Joining melanoma support groups or counseling sessions can offer emotional support and provide a platform for sharing experiences with others who have faced or are facing similar challenges. Educational resources. Patients and their families should be provided with educational resources about melanoma, its treatments, and potential side effects. Understanding the disease and its management can empower individuals to actively participate in their care. Lifestyle modifications. Sun-safe practices. Emphasize the importance of continued sun protection to prevent new melanomas from developing. Encourage the use of sunscreen, protective clothing, and regular self-examinations. Healthy lifestyle. Promote a healthy lifestyle that includes regular exercise, a balanced diet, and stress management, which can contribute to overall well-being and potentially impact the course of the disease. Survivorship care plans. Individualized plans. Develop individualized survivorship care plans that outline the specific follow-up schedule, potential long-term effects of treatment, and strategies for maintaining a healthy lifestyle. Communication with healthcare team. Open communication between patients and their healthcare team is crucial for addressing concerns, discussing symptoms, and ensuring comprehensive care. Recurrence and advanced melanoma. Early detection of recurrence. Educate patients about the importance of promptly reporting any changes in their skin or overall health. Early detection of recurrence allows for timely intervention. Advanced melanoma treatments. For patients with advanced melanoma, new treatment options, including targeted therapies and immunotherapies, continue to emerge. Participation in clinical trials may be considered. FAQ, frequently asked questions, about melanoma. What is melanoma? Melanoma is a type of skin cancer that originates in melanocyte, the cells responsible for producing melanin. It is less common than other skin cancers but is considered more dangerous due to its potential to spread to other parts of the body. Where do melanomas commonly occur? Melanomas typically develop on the skin but can also manifest in the eyes, ocular melanoma, and, although rarely, in internal organs. What are the different types of melanoma? There are several types of melanoma, including superficial spreading melanoma, nodular melanoma, Lentigo Maligna Melanoma, acrolentiginous melanoma. Each type has distinct characteristics and may require different approaches to diagnosis and treatment. What are the causes and risk factors for melanoma? Key risk factors include prolonged exposure to ultraviolet, UV, radiation from the sun or tanning beds. Genetic factors, family history or specific genetic mutations, and fair skin with a tendency to freckle. How can melanoma be prevented? Prevention strategies include sun protection with high SPF sunscreen, wearing protective clothing and seeking shade during peak sun hours, regular self-examinations and professional dermatological assessments, avoiding tanning beds and opting for safer alternatives like self-tanning products. What is the ABT rule for early detection of melanoma? The ABT rule helps identify potential warning signs. A. Asymmetry. B. Border irregularity. C. Color changes. D. Diameter greater than 6 mm. E. Evolution or any change in size, shape, color, or elevation. Why are regular dermatological checkups important? Regular checkups conducted by dermatologists help in early detection of abnormalities. Provide a comprehensive skin assessment, utilize tools like dermoscopy, assess risk factors, and offer education on self-examinations. What are the treatment options for melanoma? Treatment options include surgical excision, lymph node biopsy, immunotherapy, and targeted therapy. These approaches may be used in combination or sequentially, depending on the stage and characteristics of the melanoma. How is melanoma staged, and what are prognostic factors? Melanoma is staged based on factors like tumor thickness, ulceration, lymph node involvement, and metastasis. Prognostic factors include tumor thickness, ulceration, and mitotic rate. What is the follow-up care for melanoma patients? After initial treatment, regular monitoring through follow-up appointments, imaging studies, and blood tests is essential. Emotional and psychological support, lifestyle modifications, and survivorship care plans contribute to overall well-being. In conclusion, understanding melanoma is paramount for its prevention, early detection, and effective treatment. Melanoma, arising from the uncontrolled growth of melanocyte, poses a unique challenge due to its potential to spread to other organs. This comprehensive health guide has provided insights into the diverse types of melanoma, its causes, risk factors, and an array of prevention strategies ranging from sun protection to regular skin checks. Early detection, facilitated by the ABT rule and regular dermatological checkups, serves as a linchpin in the battle against melanoma. The importance of avoiding tanning beds and embracing safer alternatives underscores the significance of responsible sun-related behavior in reducing the risk of this formidable skin cancer. The guide further detailed treatment options, emphasizing the effectiveness of surgical excision, lymph node biopsy, immunotherapy, and targeted therapy. These therapeutic modalities, often employed in combination, showcase the progress in melanoma treatment, offering hope and improved outcomes for individuals at different stages of the disease. Prognosis and follow-up care, including staging, monitoring, and emotional support, are pivotal components of the melanoma journey. Survivorship care plans, tailored to individual needs, bridge the gap between treatment and a healthy, well-informed life post-diagnosis. Ultimately, the fight against melanoma requires a holistic approach encompassing prevention, early detection, and comprehensive care. Advances in research and ongoing vigilance in personal and professional care contribute to a future where the impact of melanoma is minimized, and individuals affected by this disease can lead fulfilling lives. Stay informed, practice sun-safe habits, and engage collaboratively with healthcare professionals for optimal skin health and overall well-being. Your health matters. Quali.health